It's early June, so it's time to talk about Hidradenitis Awareness Week. Hidradenitis suppurativa, or we're going to say HS, is a chronic inflammatory condition of the skin that is just utterly miserable, and it affects women of color 3 times as much as it does Caucasian women. A lot of the medical textbooks say hidradenitis is actually rare, but it isn't. We just need to do a better job recognizing it, and we're trying to raise awareness as dermatologists. We're trying to raise awareness that this condition is out there and people need help. And the last few years have seen an explosion in awareness of HS and resources for patients. This is my favorite one to direct people to. It's called My Gold Lining by Jasmine Epsy. And Miss Epsy, if you happen to see this, will you please drop in the comments how people can watch your video? Thank you. There's some other fun ones out too. I haven't read this one yet, but it sure gets points for creativity on the cover. All right, so what is HS? How do you know if you have it? Well, we grade HS on a 3-point scale. It's called the Hurley system. And stage 1 of the Hurley system is if you have isolated abscesses or pimples in your armpits, underneath your breasts, in your groin, in your butt crack, places like that. And here you can see an ultrasound, the hair follicle starting to widen on the surface. The disease is fairly contained in one area. It's not really spreading. This is Hurley stage 1. Hurley stage 2 is when you have multiple abscesses in there and you start to have some early sinus tract formation, i.e., tunnels that are burrowing underneath the skin, like tunnels of inflammation that try to connect sinus tract to sinus tract. Hurley stage 3 is the final and most severe form of HS, and this is what we're trying to prevent by treating everything at Hurley stage 1 or 2. Hurley stage 3 has multiple abscesses that connect with just a honeycomb of misery of fistulas underneath the skin. Oftentimes when I do surgery and cut these things out for people, I'm amazed at how many tunnels there are. It's like a rabbit's warren of misery in there. It's like someone just took a shotgun full of like buckshot of evil and just put it to your armpit and pulled the trigger. And even though I can clean this out for most people, the amount of scarring that is left behind isn't a good thing, which underscores why we try so hard to prevent this from ever getting to stage 3. If you're getting recurrent pimples and abscesses and angry boils in your folded areas like your armpits, underneath your breasts, your groin, your buttocks, don't let somebody just tell you that you need to clean more or wash more or lose weight. This isn't your fault that you have this. This is an inflammatory disease. And it's terrible that in 2023, we're still having to educate doctors on this. The Hurley stages are named after Dr. Hurley, who actually was an OBGYN, and he ended up leaving his training behind to go help people with HS because his brother Jack ended up with it. And he developed the 3 Hurley stages. This also underscores, too, that anybody can get HS. It's not just a disease of women. Anybody can get it. Where I've seen it in skinny people. I've seen it in heavier people. I've seen it in people that smoke, people that don't smoke. It doesn't discriminate. Good luck, everybody. I hope you found this information useful.